You're not hearing what I'm saying.
Oh, that's okay, Doc, because you're not saying what I'm hearing.
Man's got to know his limitations. I couldn't think of a more horrible job if I wanted to. And you have to do it.
That's great psychology. Why don't you just say something bad about my mother?
Respirator when she rushed into a hospital room to try to save a COVID-19 patient who had stopped breathing. And this brave nurse is not the only one. According to another report, over 700 staff at just one Detroit area health system have tested positive for COVID-19, and the CDC reported over a month ago that over 9,000 healthcare workers had already contracted COVID and dozens have died. And I checked with my Tampa Bay area health providers, and one Tampa hospital said N95s are still very difficult to procure. She said there's a dire need for N95s. One of my community health centers says we continue to struggle to get N95s. And there's so many folks trying to sell knockoffs. And then a large Tampa Bay area health system said the supply chain remains inconsistent and irregular, and Baycare remains concerned as we head into the fall for N95 masks. The demand will continue to increase due to the flu season and the continued presence of COVID-19. Dr. Bright, you understood that America would face a shortage of respirators in January. Is that right?
We understood America would face a shortage of N95 respirators for a pandemic response in 2007. And we have exercised and known and evaluated that number almost every year since 2007. It was exercised even as late as early as 2019, August, in Crimson Contagion, that we would need 3.5 billion N95 respirators in our stockpile to protect our healthcare workers from a pandemic response.
And you sounded the alarm repeatedly, but were ignored by the senior leadership at the Department of Health and Human Services.
I'm not going to say a ton of stuff over this. There's a couple times where I'll stop. I rolled back a little bit from when I started joining it.
We knew going into this pandemic that critical medical equipment would be in short supply. I began getting alerts from industry colleagues in mid and late January, telling me that from an outside view, from the industry view, that the supply chain was diminishing rapidly, telling me that other countries that we relied on to supply many of these masks were blocking export and stopping transfer of those masks to the United States. I learned that China was trying to buy the equipment from the United States producers to have it shipped to China so they could make more. In each of these alerts, and there were dozens of these alerts, I pushed those forward to our leadership in ASPR, to Dr. Kadlec and his senior leadership team. I pushed those warnings to our critical infrastructure protection team. I pushed those warnings to our strategic national stockpile team, who has the responsibility of procuring those medical supplies for our stockpile. In each of those, I was met with indifference, saying they were either too busy, they didn't have a plan, they didn't know who was responsible for procuring those. In some cases, they had a sick child and would get back to it later in the week. A number of excuses, but never any action. It was weeks after my pushing that finally a survey was sent out to manufacturers or producers of those masks, a 5-page survey asking producers or companies if they actually made those masks.
In your whistleblower filing, you discuss a February 7th meeting of the department leadership group at which you urged the department to focus on securing N95 masks. Can you describe what happened at that meeting?
They informed me that they did not believe there was a critical urgency to procure masks. They conducted some surveys, talked to a few hospitals and some companies, and they didn't yet see a critical shortage. And I indicated that we know there will be a critical shortage of these supplies.
What's the issue, guys? What'll I fix? Is everything okay? Do you hear audio okay? Let me know in the chat room and all that.
We need to do something to ramp up production. They indicated if we notice there is a shortage that we will simply change the CDC guidelines to better inform people who should not be wearing those masks, so that would save those masks for our healthcare workers. My response was, I cannot believe you can sit and say that with a straight face. That was absurd.
In fact, it took 3 months from your initial warnings until mid-April for the federal government to invoke its authority under the Defense Production Act to require the production of millions of more N95 masks. And even then, the administration required the production of only 39 million masks, which
they didn't require them, they paid for them.
Which is far fewer that you and other experts said that we would need. What was the consequence of this 3-month delay and inadequate response? Were lives endangered?
Lives were endangered, and I believe lives were lost. And not only that, we were forced to procure these supplies from other countries without the right quality standards. So even our doctors and nurses in the hospitals today are wearing N95 marked masks from other countries that are not providing the sufficient protection that a U.S. standard N95 mask would provide them. Some of those masks are only 30% effective. Therefore, nurses are rushing in the hospitals thinking they're protected, and they're not.
Thanks, Jim.
Thank you for your courageous effort.
Gentlewoman's time has expired. A pleasure to recognize our colleague from Indiana, Dr. Bouchon, for his 5 minutes.
Thank you, Madam Chairwoman, and thank you, Dr. Bright, for testifying. I appreciate it. I was a cardiovascular and thoracic surgeon and been in healthcare for over 30-some years, so I want to comment on, I'm not going to ask a question about hydroxychloroquine. I just want to comment on how the medical community responds to this type of thing. Doctors across the country will use drugs off-label in a circumstance where they don't have or they don't see a viable alternative to that. And I think this is one of those circumstances. I'm hearing from doctors across the country. And look, I'm with you. You have to have double-blind studies. You have to have proof under normal circumstances. But in this situation, I think a little bit of understanding and leeway from the federal government is in order. We do want to ensure the safety. This is a drug that has been proven safe for many, many years in the appropriate doses. It does prolong the QT interval, as you've outlined, which can lead to cardiac arrhythmias if not used properly. But I mean, tell you, when states tried to stop doctors from using this, there was such a backlash, they had to back away from it because the physicians in the community wanted to use it. And so doctors like me out in the real world, if things are working, even anecdotally, they're not going to wait for the government bureaucracy to approve it. I just want to get that on the record. I'm just saying this is why doctors are using this drug. Whether it's right or not, data will show. But you know, if 2 years from now we have the studies and we say, hey, that stuff really would have worked, and the government stopped that from being used, if I was a family of a person that was stopped from getting hydroxychloroquine, I'd be pretty mad.
How would you feel if your family member was given hydroxychloroquine and it gave them a heart attack and they died and it wasn't useful at all?
I talk about the supply chain
because the president told them to.
Issues, right. And as it relates to PPE, the personal protective equipment, and I think there's enough blame to go around in the federal government about what happened there. For, you know, after H1N1, where our national stockpiles were depleted, we didn't replenish them. We've had people on both sides of the aisle talking about this, and I think there's some blame to go around. But you know, I don't want to be accusatory, but I do want to go over some of the facts about BARDA's situation as it relates to the masks. Okay, and according to Washington Post report in 2015, the Obama administration and a company now known as O&M Halyard, H-A-L-Y-A-R-D, announced a project to develop rapid pandemic mask production line. According to federal contracting records in 2017, HHS signed off on a $3.3 million, with an M, payment to Halyard to build a machine that could churn out millions of protective respiratory masks at a high rate of speed during a pandemic.
Hey, Hal Vickery.
However,
Thank you.
in September of 2018, CNBC reported that the machine was never built. And despite BARDA's $1.5 billion with a B budget, the Washington Post reported there wasn't money to pay for the project. Why was the project scrapped, and did you sign off on that decision?
So that project with Halyard was to build a novel new machine to make a respiratory protection face mask faster, as you described accurately. Right. Actually, the technical team must have reviewed that proposal on the next step or the further investment in that machine. I believe that the investment to date was made to design the machine, build the blueprint of the machine, and I'm not even sure if it was to build the actual
at that time, in September 2018, were you the head of BARDA?
In 2018, I was the director of BARDA.
Right, so did you sign off on the decision? Because I would expect a decision like that, a contract, money was allocated apparently from HHS to BARDA to do this. I wouldn't expect that to be scrapped without the director of BARDA signing off on that, right? So did you sign off on it? It's a yes or no question.
Not necessarily scrap the project, sir. I don't know what the proposal was. That we rely on a very thorough vetting process in our contracting office. So that proposal to further continue that project never made it to me. So if it wasn't approved, it didn't make it through the proper vetting process in BARDA. The decision to end or continue that project was not brought to me.
Okay, I find that surprising, but I'll take your word for it.
They have a group of people who looks at things for how worthwhile they are, and those people are trusted and can do their job. But go ahead and deep state everybody. Puffy cardiovascular surgeon who doesn't do that anymore from Indiana.
Nicole Lurie, who hired you, told the Washington Post that the Halyard contract was part of an explicit strategy to ensure we could surge mass production in the next crisis. Well, now we're here and we don't have it. So we're dealing with the consequences of that decision. And in addition, I guess, to the Halyard, I keep saying that wrong. It is my understanding, well, I'm running out of time. So what I'm going to just say is, look, to doctors across America, you know, it's easy for us to sit in Washington, D.C., whether we're members of Congress or whether we're agencies, and talk in the abstract about people dying in our intensive care units, but when you're the physician at the bedside and there is a medication that has promise and that has a safety profile that we understand, doctors will use this medication offline, and that's what's happening.
Yeah, there's a huge difference between doctors experimenting with it or trying different things to solve a problem that's right in front of them, and from the top down, the government insisting on its use and buying massive doses and promoting its use beyond that. That's not doctors coming up with apropos of nothing or their own experience. That's the government buying it and shoveling it.
And
they're picking winners and losers.
You know, whether that's right or wrong, we might take us years to prove, but in the meantime, people can die. So I yield back.
Yeah, people can die of hydroxychloroquine.
Gentleman's time has expired. It's a pleasure to recognize the gentleman from Maryland, Mr. Sarbanes, for his 5 minutes of questions.
Thank you, Madam Chair. Dr. Bright, welcome back to this committee. The United States government deploys millions of dedicated
Don't touch the inside of your mask.
public servants working together to achieve our shared goals as a nation, to promote effective government, and to protect the public interest, in this instance, to protect the public health. As a scientist and public health official, that was your charge, and you took it seriously. Unfortunately, the record shows that your superiors at HHS and potentially beyond, instead of valuing your expertise and experience, squandered it in ways that in this moment, in the face of this crisis, amount to gross negligence. They ignored your science-based pleas to pursue critical strategies, for example, your repeated calls to obtain virus samples from China and to find supplies, masks, respirators, swabs. They dismissed your science-based warnings about pursuing unproven strategies. They dismissed your concern, for example, about the stampeding towards hydroxychloroquine. We've heard about that today. And they sent you on errant missions to find treatments with little therapeutic value, all for the sake of satisfying political cronies. And you've testified about the miracle cure drug that was an example of that. Ignoring, dismissing your input was not harmless malpractice, because there's every reason to believe that if that input had been heeded, particularly your pleas for action in the early days of the pandemic, it might have saved thousands of lives. I want to thank you for coming forward. I want to thank you for blowing the whistle on the misguided and chaotic response to this pandemic. I am sure there are specific conversations, emails, moments in time that you remember like they happened yesterday.
There's a mix of people
the
wearing
inflection points where if the response to your warnings had been heeded, things might have been different. And I'm sure they haunt you and keep you up at night. From January of this year, tell me about just one specific moment when you had that sinking feeling in the pit of your stomach because you were not seeing the response that you knew needed to happen.
Congressman, I'll never forget the emails I received from Mike Bowen and indicating that our mask supply, or N95 respirator supply was completely decimated. And he said, we're in deep shit. The world is, and we need to act.
Okay.
And I pushed that forward to the highest levels I could in HHS and got no response. From that moment, I knew that we were going to have a crisis for our healthcare workers because we were not taking action. We were already behind the ball. That was our last window of opportunity to turn on that production to save the lives of those healthcare workers, and we didn't act.
Listening to your testimony gives me chills because it all adds up to one inescapable conclusion. It didn't have to be this way. There was another path. Things could have gone differently. The federal response to the pandemic could have been much more effective. So here we are, at a moment when our country needs the kind of expertise and science-based guidance that you and others like you can offer us. These voices are too often being sidelined. Things are upside down. In you, we have someone who made the right call in the early days and has been removed from your position, while so many people who made the wrong call still have their jobs. Dr. Bright, when the counsel that you and others offer is cast aside, and I know you know this, it means that science and reason are also being cast aside. That's a dangerous impulse. It's an attitude that deprives our country in this critical moment of any real chance of getting ahead of this pandemic. But hopefully we can learn from this. There's still time to put science and reason back into the national strategy for fighting COVID-19. We need people like you to help lead us through this.
So I appreciate what John Sarbanes is doing here. But I think we're going to get let me jump forward because I did back up a little bit. Let me see if I can jump forward to Raul Ruiz. How many of these folks are there in this? Oh God, this is awful. Hold on one second. You want your blood to get to boil? Here we go. This is annoying.
At that time, it was a different group of individuals who were focused on procuring PPE.
Dr. Bright, just yesterday, the president questioned the testimony of Dr. Fauci when discussing children and schools. The president insisted that, quote, it has very, very little impact on young people. Dr. Bright, yes or no, do we know that the president's statement is accurate?
There's a lot we don't yet know about this virus, and it's really concerning over the last few weeks that we're getting more and more data out of New York and other places where they've had high numbers of infections of the impact of this virus in children. Is very different presentation and outcome in children that we see in adults, and it's very concerning, and we don't yet have an answer for that, but we should proceed very cautiously and not have any hope or knowledge that we know everything about this virus.
Dr. Bright, I want to end by quoting your testimony, quote, without clear planning and implementation of the steps that I and other experts have outlined, 2020 will be the darkest winter in modern history. The darkest winter in modern history. Yes or no, do you believe this administration is doing everything it can to prevent the darkest winter, and what more should they be doing?
I believe there's a lot of work that we still need to do. And I think we need still, I know, we need still a comprehensive plan, and everyone across the government and everyone in America needs to know what that plan is and what role they play. There are critical steps that we need to do to prepare for that fall, for that winter coming. We do not still have enough personal protective equipment to manage our healthcare workers and protect them from influenza and COVID-19. We still do not have the supply chains ramped up for the drugs and vaccines, and we still don't have plans in place on how we distribute those drugs and vaccines, and we still do not have a comprehensive testing strategy so Americans know which tests do what to do with that information, and we know how to find this virus and trap it and kill it. There's a lot of work we still have to do.
Gentleman yields back. A pleasure to recognize the gentleman from Oklahoma, Mr. Mullen, for his 5 minutes of questions.
Pleasure.
Thank you, Madam Chair, and I'd be remiss not to thank you for your continued prayers for my son. That's very kind of you, and I really appreciate it. Dr. Bright, you're here on your own time as an individual, is that correct?
Yes.
Where are you currently employed?
I'm currently an employee of the Department of Health and Human Services, and I'm in the middle of transition, I guess you would say, between BARDA and the NIH.
So you've accepted the reassigned position to NIH?
Except that this position is under discussion at this point. I have not yet accepted that role.
So are you currently being paid?
I'm currently being paid.
Where are you being paid from, out of BARDA or from NIH?
It's not completely clear to me, but I believe it's out of NIH.
So are you getting a paycheck since you've been over there since mid-April, right? Is that correct?
I've received one paycheck, sir.
What, from NIH?
I think it was still part BARDA and part NIH. I've had discussions about my onboarding process at NIH.
Are you at BARDA?
Sir. If you're getting a check from NIH, you've accepted that thing, and so that means you're perfectly fine with everything. I yield the rest of my time to a gnome living under a bridge.
You made $285,000, is that correct?
That's true.
So how much are you currently making at NIH?
I don't think my salary has changed.
It's still the same? So you've been over there for approximately 4.
So it's about how much money he makes. As long as he's making the same amount of money, who cares how many lives live or die?
4 weeks, a month?
It has been about 3 weeks since I was removed from my office at BARDA.
So have you reported to NIH yet?
I've checked in with the NIH director's office, and we've discussed the onboarding process, the fingerprinting process, and we had a call just last evening to discuss a framework of my responsibilities that they have envisioned for me at NIH.
So you haven't actually reported to work, but you're still getting paid, correct?
I've been on sick leave since I was pushed out of my position at BARDA.
Sick leave for what?
For very high blood pressure, and I've been under treatment for my position.
For hypertension?
For hypertension, sir, yes.
So you're on medical leave?
I've been on medical leave. This week, however, I transitioned from that medical leave to annual leave so I can manage this.
What is annual leave? What do you mean?
It's vacation time. So
same thing you have.
You're on vacation time right now?
I'm on vacation time.
Did you inform your supervisors about you coming here today, or did you need to do that?
I have informed them about my leave status, and I've had a conversation with them last night.
So you transferred from medical leave to vacation this week, or does it start next week?
I had a conversation.
You guys getting all this, by the way? Yeah, I know you guys. I hope that there's a link below for the Google Calendar in case you need his vacation versus sick leave time put in there.
Conversation with my physician about my hypertension and how we've been managing it over the last 3 weeks, because this has been very stressful to be removed suddenly without explanation from my role and position. It's a life change for me. And my physician has been working very closely with me to manage my hypertension and stress. And the conversation I had with him last night indicated
I guess I'm kind of confused there, because you say you have hypertension, but yet you were able to do these interviews, you're able to make the report, and you're able to prepare for this hearing, yet you...
Yeah. Ask all your colleagues who have hypertension who are still at work for being treated for. Is he supposed to be bedridden?
You're too sick to go into work, but you're well enough to come here, while you're still getting paid from the United States government. Is that correct?
Sir, I've been under medical leave until
I get that, but if you've been underneath medical leave, too sick to do that, but yet you can prepare for a 2-hour hearing, I just having a hard time.
I don't understand how people with hypertension can function for 2 hours in a row.
Tracking that. I have I have a hard time understanding that. And if you have hypertension and you're too sick to go to NIH, but you didn't ever experience that in BARDA, right? You never had issues in BARDA with hypertension?
I didn't have the level of stress of being removed from my position while I was in BARDA, so this has been very stressful. And my position.
I get it. People handle pressure. People handle pressure quite different. But as a director of BARDA, I'd feel like you're in quite a bit of stressful position when you're trying to manage a pandemic, but you can't manage that, or you could manage that, but you can't manage your own hypertension when it comes.
Yeah, see, personal matters tend to hit you a little closer than the thing you've trained for your whole life to deal with. As a matter of fact, some cops and EMTs and other people find it oddly relaxing in high stress situations. It's afterwards when they're dealing with the personal ramifications that they get the stress, whatever. But you're not asking that reason. You're just calling him a wuss.
Comes because you got removed from the office, but yet you can still receive pay from NIH, but you can't show up for work, and then all of a sudden you can prepare for this.
He had 2 weeks of medical leave because he was stressed out when they're moving him over. Now he's on vacation because he feels better, because the stress is passing and he's got a plan and he and his physician are working on that. And then he's using his vacation time to decide whether or not, which he's owed, whether or not to take the next job. You, sir, are an asshole.
For this, but you can't do that. I just have a hard time understanding it.
Well, that I believe.
I know you're a bright individual and very smart, but you are an employee of the federal government. And I just want to make sure you're not doing something to deceive the American people at the same time getting paid.
That's what he is. He's squeezing an extra paycheck out of the American people. That, dude, have you checked the return on investment that your constituents are getting in Oklahoma right now?
From the United States government. With that, I'm going to yield to our ranking member, Walden.
I thank the gentleman. Dr. Bright.
That was the lead-in. That was his thing. That was his whole, that was it. Are you?
Your lawyer appears to have a pretty substantial binder there, and I know Mr. Guthrie asked about the documents that are on the table. Are those the exhibits to your complaint to the Office of Special Counsel?
I don't know what these are.
I'll direct it to the counsel then, since she's answered other questions. Are those the exhibits to the complaint to the Office of Special Counsel?
Some are, and some are my work product, and some are my notes, and they're not appropriate to turn over to Congress.
So is it appropriate to turn over the documents that are referenced in the complaint, not your work product, I respect that, to this committee? And would you?
You have them. They're government documents.
Do that.
You have them. They're government documents. You have them. They're government documents. He's a government employee. All of his emails related to this that he's referencing and all the back and forths.
I asked that question initially, and I said we would look at the documents to determine whether they are appropriate to turn over.
I'm just talking about the ones that we have partial email chains, we have screenshots of emails. I think we should have the right to see those documents if we're going to effectively know the full extent.
You do. You have oversight over the NIH and the CDC and the task force. Ask for the emails from them.
Of this complaint. And I just wish you would commit to turn those over. Dr. Bright, will you turn those over?
They're not his.
I think I addressed that.
Dr. Bright, I'm asking Dr. Bright now.
I've submitted my full complaint to the Office of Special Counsel, and that is the process I know to follow. So,
but you're here as an individual citizen.
Gentleman's time is expired.
Whistleblower, we just want to see what you've submitted so we can evaluate it ourselves.
Sir, I don't
You don't have the complaint?
understand the full process, other than I was supposed to submit it to the Office of Special Counsel, which I've done so. I don't understand the legalities of sharing that before they've had their opportunity to review that. And
they've certainly been shared out into the public and press. The Washington Post has them from some source. They look a lot like what's referenced in your complaint. None of us, I don't know where those came from, but you know, other media outlets are certainly seeing them. I just think as part of this investigation, Madam Chair, you should request them.
You have access to all those. You work, he's a government employee.
We will seek all information that's appropriate to be submitted to the committee. And what I circulated, or we circulated, to all members of the subcommittee were the emails that were public, as well as the complaint. That's what was out there.
I know,
now,
but
I haven't
any other
tracked daily who
investigation-
says what. I mean, maybe Politico has something too. I don't know the veracity of things.
But in
like
any
that.
other, any other investigation, we'd both be going, say, we need to see all the documents.
You have them. Request them from the National Institute for Health and the CDC and BARDA.
The committee. So that's all I'm after.
Madam Chairwoman,
Just the
may I
facts.
address one?
Just the facts. Just the facts. That's what he's really worried about. Oh, I'm on the wrong sound set again. That would have been so perfect, and I just blew it.
Just the facts, ma'am.
Listen.
No, I think we need to move on. The gentleman.
Yeah. Since you're in the House Energy and Commerce Subcommittee on Health, you have access to all the internal documents at the NIH and the CDC for the purpose of oversight. Everything he is discussing has to do with the use of budgetary funds to purchase items, drugs, PPE, keep the stockpiles full, which is in direct oversight of directly under the oversight that the Congress has. Go ask them for it.
From Oregon is recognized. Mr. Schrader.
Thank you.
Hello,
Thank you for being
Mr.
here, Dr. Bright. Really appreciate it. Tough to do. Very impressive that you're here. Could you describe the tone and reactions of Dr. Kadek?
Why is that guy covering his face with his coat to talk to the other guy with a mask? And by the way, there goes
Dr. Azar, your
heart attack over here.
January 23rd meeting when they had the all agencies meeting on the COVID virus. Could you describe how up to speed they seem to be?
By the way, I'm digging the hippie masks.
In that meeting, sir, it was one of our first meetings that we had about how to address the outbreak. And because we had practiced, I came in with my list of needs, and those lists for money, people, and viruses. My request was met with a bit of surprise and puzzlement. I remember Secretary Azar looking around the room and saying, money, you need money, maybe there's money somewhere. I mean, it was just something that...
Maybe there's money somewhere. That sounds like, let me look in the couch cushions. Maybe there's something.
Despite the fact that we had the outbreak in China for some time.
This was January 23rd at this point.
Could you describe January 25th, if you remember, email exchange with Mr. Bowen on the map?
By the way, can I remind everybody that device to mass produce PPE, especially N95 masks, very quickly, that they had licensed with somebody to try to make a deal to have them develop something, and they were working in partnership with the private company, and it was $1.3 million to try and make this machine. Now, it failed. A failure, depending on what you learn from it, can be valuable, I suppose. $1.3 million seems to be the concern point for this. What is it, $136 million we've spent sending Trump golfing, period, not developing a machine that would eventually produce N95 masks forever, I guess. No, all right.
On the mask situation.
I don't remember that specific, but I'm sure it was urgent. I'm sure that Mr. Bowen was sending me a notice saying, asking if this.
So you didn't ask him to come and talk to you. He just reached out to you.
Yes, sir.
Okay. How about an email exchange with Dr. Kerr on January 27th? Did you reach out to Dr. Kerr? Did he come and wanted to?
Dr. Kerr reached out to me, I believe. This was because, again, he is a pandemic influenza expert as well, response, and he knows the vital nature of needing those viruses, and he was involved in prepping our secretary for a call he had with the Vice Minister Ma in China. And we knew a high priority was for our secretary to ask for those viruses. We've had challenges in the past in getting viruses from China from avian influenza strains and viruses. So this was a high priority because we needed that to get started. And he was alarmed when he wrote to me that morning indicating that the CDC director had reprioritized and actually indicated we did not need, or he did not need to, the secretary did not need to ask China for viruses. And it was alarming to us because we knew how critical it was.
Now, that sounds incredible in light of what has transpired since then. So I guess my major point here is that we have a brave individual coming forward as a whistleblower, but he is not alone. There are many other experts, scientists, and manufacturers that realized we were in, if I may say, deep shit not a long time ago, long before the administration and the White House began to wake up. What do you think would have happened if Mr. Navarro had not reached out to you and actually responded to you? Where would we be now if you hadn't been able at least to get one person in the White House's attention?
It's difficult to speculate where we were. So even when Mr. Navarro reached out and strongly suggested that action be taken on February 10th, and February 9th is in the email, February 10th, it was conveyed to Dr. Kadlik that we needed to ramp up production of N95 masks. That order did not go out, that solicitation did not close till March 18th. So even with the pressure of Mr. Navarro, who I believe shared a sense of urgency about this outbreak, that pressure alone still did not spur Dr. Kadlik and our strategic national stockpile into that urgently needed action.
Well, that's very disconcerting, and the reason we're here today, perhaps. Last question, if I may, and switching gears and going to the other side of the spectrum, while it's been hard to get folks' attention here in Washington, D.C. and the administration on the seriousness of this, I think most people now are convinced this is a very serious issue. And I'm a little concerned we're going too much the other way in terms of information. You alluded to it here on the vaccines. I think some people are under the impression there's a vaccine going to be developed in a couple of months and everything's going to be fine. I can go back to work. And we unfortunately have to juxtapose economic issues. They have to have realistic expectations at home. And you, I think, accurately indicated, well, it can take up to 10 years. And, the quickest we did, I guess, was Ebola, and that was, I believe, 5 years. So, is it tough question to ask? I suppose you don't have to answer. But I mean, I don't want America to think they can just not get back to some semblance of a new post-COVID life until a vaccine comes out, because that could take years. And there's a chance the vaccine will maybe not be as effective, much like our flu vaccines that, with the flu mutating year to year sometimes. So I just want to make sure that ask you if you would agree that we can't wait to open up America entirely until a vaccine is there. We have to use some of the other parameters you've already suggested.
We have to make sure that we have some scientifically led and driven decisions on how and when it's safe to reopen America. If it happens before we have a vaccine, if we have a vaccine faster, that's great, but if we do need to open America up sooner, we need to make sure everyone understands the risk and understands the risk of their activities, and everyone has to play a critical part in following those activities to reduce the risk. We have to have a testing plan in place and enough tests to make sure that we know when people are exposed so they can be quarantined and isolated and not continue to infect others. And we also are developing...
By the way, these are the emails that they're referencing in here. And all of them are on NIH or CDC stationery and on email chains available to them.
Developing a number of therapeutics that could offer some potential benefit prophylactically or protect you almost like a vaccine before you're infected. And those are being developed and maybe even faster than a vaccine. And if healthcare workers and frontline workers can use those therapeutics, then that might offer them some protection as well until there is a vaccine. So there's a number of steps in between now and a vaccine. I believe if we let science lead the discussion and we inform America of the risk and the clear guidance on what needs to happen and people follow that guidance, then there is a stepwise process to getting back to work and back out of our homes.
Great,
Gentleman's
thank you very
time
much.
has expired. And he yields back. Pleasure to recognize the gentleman from North Carolina, Mr. Hudson, for his 5 minutes of questions.
Thank you.
I'm wearing my American neck thing.
Madam Chair, first let me say I believe any whistleblower should be respected and allowed to be heard.
Except you.
As a core component of keeping our government accountable and running smoothly. But this hearing is not about a whistleblower complaint. It's about undermining the administration during a national and global crisis.
Listen, if anybody, I learned how to wear a mask from Dr. Burks.
That's evidenced by the fact this hearing is being held in the wrong subcommittee and well before the Office of Special Counsel finishes its work. To disregard the minority so spectacularly in the organization of this hearing only highlights the partisan and political nature of this hearing.
Yeah, what's the rush? It's only a pandemic. Come on, man. It's not like people are dying or something. It's not like we don't have a cure sitting there. I mean, come on, just throw back some hydroxychloroquine, do a shot of Lysol. I suck on one of them towels over my shoulder.
I hope today will be held up in the future as a lesson of what not to do.
It will. Congratulations. Good luck in your next election cycle.
And the respect and gravity that should be given to whistleblower complaints so that they're not abused for political expediency. More importantly, though, we have vital work we should be doing. My constituents want Congress to get back to work.
Oh yeah? What do you call this? Figuring out how the people who were in charge of our pandemic response were blowing it and fixing that problem? What work do you normally do on this subcommittee?
So I'm glad to be here to highlight the important work that needs to be done.
Great, do it. Let's hear it.
I heard from an ophthalmologist in my district this week about the need for relief. She says she'll consider this year a success if her practice group even breaks even.
Yeah, we're all in a pandemic.
Long story short, we should be examining
Long story short, too late.
the $175 billion authorized and appropriated in a bipartisan manner for providers and what providers still need and recommendations for moving forward.
Providers, medical providers, healthcare providers, or just dads? What are you talking about?
We should also be examining why there are gaps in outcomes and access for minority communities. Fayetteville, North Carolina, in my district, has a large and diverse community.
And this would help them too, knowing that bullshit medical nonsense was being crowbarred through HHS and the NIH and the CDC. They would kind of help them if there was enough. See, when there's not, thank you so much, Amber. When there's not enough PPE, one of the areas where there's it gets hit really hard is minority and poorer communities, and so they might be interested in why we didn't, for example, shore up our supply in the last 3.5 years.
And understandably, the folks back home
and let them rot on the shelves.
We're scared because coronavirus hits them hardest. Why are we not spending our time today examining this crisis within a crisis more closely?
We're not? Because coming up with proper treatments and not like shoveling through bullshit would seem to benefit everybody, especially the groups hardest hit.
I hear from providers and hospitals about issues with PPE. I know this administration has done extraordinary things to secure more PPE. I want to thank President Donald Trump.
Extraordinary? No. Ordinary. Ordinary. Everything about this has been ordinary.
Trump for his strong leadership.
And for helping me pick out my Christmas tie.
Not only did his administration move quickly to coordinate a response, but his travel ban on January 30th was a bold move.
Yeah, only 40 other countries and 3 major airlines had done it beforehand. It was so bold.
It was panned
that he went immediately golfing.
By his critics as an overreaction at the time. The administration has gone to great lengths to overcome an inadequate system they inherited. As you testified earlier, move quickly.
They inherited 3.5 years ago.
To start programs like Project Airbridge to expedite more.
Project Farting Eagle. Project Farting Eagle.
Zeus's butthole did you get out of your cell?
More PPE coming in. But questions remain about why there is a global shortage and what more Congress can do to support the administration's efforts to secure sufficient PPE.
Yeah, have you been listening to what he's been saying all day? That we have to get ahead of these things. You don't just buy them when it becomes a problem. You prepare for the problem. Like when you roll in. Thanks, Persian chick. All right. When you start your administration, you from that day forward, you act as though you are responsible for the country from that day forward, because you are. And any supplies that you're supposed to replenish during your time as president so that they don't rot and become useless, and things that require maintenance actually get maintained, you do that when you're president, instead of blaming everybody before you for stuff that wasn't even right.
This committee should be working on that question. We have multiple pieces of bipartisan legislation waiting to be considered to improve the operations of the strategic national stockpile.
The strategic.
We should be examining why our stockpile was allowed to dwindle under previous administrations.
It wasn't. We used the stockpile under H1N1 and Ebola because we didn't want to burden the hospitals and the states, because that's what it's for. How much time has passed? How long has this asshole been president?
The answers to these questions and solutions to...
When does it become Trump's responsibility? Middle of second term? When is it? After? When you're building his library?
These problems are timely and critical to helping this administration combat this virus and the deadly disease it causes. I hear from constituents every day who are suffering under these stay-at-home orders.
Yeah, that's what they're suffering under.
Crisis is hard for anyone, who even if they weren't suffering from substance use disorder or mental health challenges.
So suicide and drugs is what he's talking about.
Before they were
That's the Trump line.
confined to our homes. And this crisis has exacerbated this problem. Why are we not examining access issues to mental health providers and the effects this crisis has had on our constituents' mental health?
A solid question. There you go. I'll tell you why. Because that's not this committee's work. You do that in another committee, and you do that in your state with your governor, because all medical facilities, mental health facilities in your state are state-run. There are no federal loony bins. This is not 1920.
Right, you're no doubt an accomplished scientist, and I appreciate the service you've rendered this country.
But
you deserve.
Why will you not allow us to pour hydroxychloroquine down the gullet of sleeping veterans who are sick and dying, just to see if it works, so the president will know if he can use it when he needs it?
To be heard, and your whistleblower complaint should be given the serious consideration any whistleblower complaint deserves. But we also deserve to have the opportunity to ask questions about serious allegations that have been made against you. And I'll note again, this is not the time or place for that hearing.
Why not? You brought him up.
The time is after the Office of Special Counsel has completed its work, and the place is the Oversight and Investigations Committee. But Dr. Bright, building on questions from Mr. Walden and others, Politico released an article yesterday stating that your complaint left out a lot of information and context regarding agency decisions to acquire hydroxychloroquine. You chose not to elevate your concerns to the Office of Inspector General, but instead kept selected screenshots that didn't include full context. Another example, the Wall Street Journal reported on an email today that seems to show that you were in support of acquiring and using hydroxychloroquine. Can you elaborate on what was missing from your screenshots and why you didn't elevate your concerns at any time to the Office of Inspector General?
So the early days of when I was aware of the hydroxychloroquine, we were interested in acquiring that drug for its use in a randomized controlled clinical study. Actually, when I heard from Dr. Woodcock that it's something that we should try to investigate in a randomized controlled study, I even reached out to a company that was licensed and approved to make that drug in the United States to see if they could donate that drug to the NIH to conduct those clinical studies. I was aware of other efforts that were ongoing to try to acquire some of that drug for its use in randomized controlled clinical studies. As long as it was going to be used at that time for those randomized controlled clinical studies, I thought we should look into the supply chain the same way I did with remdesivir. It was only after I learned that that supply that was being discussed was coming in from Pakistan and from India, from facilities that were not approved by the FDA, and the drug was not approved for use in the United States, that I became increasingly alarmed of having that drug in the United States. Second, it was when I learned that the plan was to make that drug available through an expanded access program so people could potentially get that drug and not be under the close supervision of a healthcare provider, that caused significant concern. It's because of that and the cascading days
normal sense
afterwards that we put in that emergency use authorization with the safety bumpers and barriers that we could feel comfortable with, that drug would only be used under close clinical supervision. But in the earlier days, in that email exchange that you're referring to, was before we knew about this information in Pakistan, before we knew it was going to be used for expanded access protocol. It was when I thought our efforts to obtain some of that drug would be used at the NIH to conduct randomized controlled clinical studies. So I was relieved that we did identify some supplies of that drug for those clinical studies.
Jim, my time's expired, Madam Chair. I yield back.
Yeah, well, gentleman yields back. Pleasure to recognize the gentleman from Massachusetts, Mr. Kennedy, for his 5 minutes of questions.
Dr. Bright, thank you very much for being here.
We choose to do these things not because they are easy. Oh,
and
sorry.
Thank you for your service to our country. Let's ground this hearing a little bit. As of this morning, which means these numbers have increased, there's nearly 1.4 million cases diagnosed of COVID-19 in the United States and over 80,000 fatalities. Experts believe both of those numbers are an undercount because...
By the way, breaking news, Politico's breaking this, that Richard Burr is stepping down as Intel panel chairman because of the stock scandal where they seized his phones yesterday. That's just breaking news.
After 5 months of this virus being on our shores, we still have a systemic problem with regards to robust testing. Is that right? Cases in many states across the country are still actually increasing in number despite that lack of testing. Is that right? You've mentioned in your testimony that, quote, we missed early warning signs and forgot important pages from our pandemic playbook. Is that right?
Yes.
We forgot the torn ones, the ones that were in the circular file that was next to the president's desk.
Sir, you've been the head of BARDA since 2016, is that right?
Yes.
Until recently. Have you experienced any pandemics prior to this one over your course of time, either there or in your prior government service?
We responded to the Zika outbreak. We responded to the Ebola outbreak. They didn't rise to the level of pandemic.
Of course not.
But yes.
Right. Thank you for the clarification.
That's interesting. You guys were able to respond to that in a previous administration, and they didn't rise to the level of a pandemic. Interesting.
Sir, you're aware at the end of the Obama administration, the Obama team put together a playbook to try to guide succeeding administrations on how to handle an outbreak, correct?
Yes.
Sir, you're also aware that there's a simulation done from an outgoing Obama administration in January 2017 with an incoming administration about how to respond to a pandemic. Is that right?
Yes.
And you're aware that the Trump administration cut the number of CDC staff located in China from 47 to 14. Is that right?
I don't know the exact number. I know it was reduced.
Okay. And sir, you referenced already the simulation called Crimson Contagion. That was a simulation done by HHS begun in January.
And it's a great Robert Ludlum book as well.
January of 2019. Can you shed
Crimson Contagion.
Just very briefly, a little bit of light as to what the findings of Crimson Contagion were?
The significant
we found that it was one of Slayer's best records, but it really was slept on by the fans.
Findings. It was actually the participants were beyond HHS, it covered broad areas of government and federal and state and locals. Some of the significant findings were the need for improved coordination and communication and alignment between the federal and state and local tribal territorial governments, and the significant need for personal protective equipment and the shortage, and a significant need for funding initially.
And sir, that simulation was based off of a flu-like virus that was initially detected in China, spread by global air travel, and resulted in the infection of 110 million Americans, leading to 7.7 million hospitalized and nearly 600,000 dead. Is that right?
Yeah, and what that means is no one could have imagined anything like this ever happening. Nobody even could have, who even heard of such a thing? No one has heard of anything like this. That's why these aren't the droids you're looking for. Did that work?
Right.
Yes.
Sir, are you When did you first have concerns about the potential impact of COVID-19 on the United States?
In early January.
And were you aware that your supervisor, Dr. Cadlick, suggested that the activation of the Defense Production Act in mid-January?
I wasn't aware of him doing that, no.
Okay, well, you mentioned that you had 2 meetings with Secretary Azar. I'm sure you had others, but you referenced so far in your testimony meetings on January 23rd and 27th, where you raised concerns directly to the Secretary. Is that right?
Yes.
And
the Secretary was not at the second meeting. Deputy Secretary Hargan was there.
Thank you. You're aware that top National Security Council staff, including National Security Council.
So the first meeting you had with a warning of a global pandemic that was on its way and we weren't prepared for it, the Secretary was there. At the next meeting about that, he sent his assistant.
National Security Advisor, Mr. O'Brien, and his deputy, Matthew Pottinger, raised significant warnings that China was downplaying the impacts of this virus.
I did learn of that in the meeting at the White House, yes.
You're aware that we sent 17.8 tons of medical supplies to China in early February.
I've learned of that.
Are you aware that the Trump...
17.8 tons of PPE.
Administration budget...
Why does that number not get brought up in the list of, we've got 4 billion masks, we sent 17 million tons of PPE to China?
Proposal released in February of 2020 called for a cut to CDC by nearly $700 million.
I'm not aware of that. I've heard of it.
Are you familiar with a memo written by Peter Navarro that warned of the impact of the virus?
Yes.
Are you aware that it was spread among senior administration and White House officials?
Yes.
Are you aware that it was on or about April 2nd when the Trump administration finally activated and expanded the Defense Production Act, months after being warned by you and other senior administration officials?
I've learned of that.
Are you aware that that order itself did not extend to the full authority of the DPA and left a haphazard allocation process to states and hospitals to compete against each other?
I don't know the details of that authority, sir.
Has the Coronavirus Task Force actually developed a plan for reopening the country?
I'm not aware of the full plan to reopen, sir.
Have they developed some principles that the White House has touted as some principles or guidelines as to how to reopen the country?
I've heard of some principles.
Are states following that plan?
It doesn't appear that there is a nationwide coordinated plan that states are following, sir.
So after this recitation of the actions and inactions of this administration over the course of the past 6 months or so, can we possibly say that this administration has prepared our country for the moment that we are in, and how we could possibly be prepared for the distribution, development, manufacturing, and distribution of a vaccine to try to address 330 million Americans over the course of the months ahead?
I think we have a lot of work to do to be prepared, sir.
You
I
are
don't think
too
we're
kind.
fully prepared.
Thank you, sir. Yield back.
Gentleman yields back. Pleasure to recognize the gentleman from Missouri, Mr. Long, for his 5 minutes of questions.
Very exciting.
Okay.
We can go to
Should we go to,
Did he leave?
you want to pass?
I think we're going to reserve, yeah.
Okay, you can reserve, and we'll go to the gentleman from California.
I would rather not
Mr. Cardenas,
embarrass
for his
myself.
5 minutes of questions.
Okay. Thank you, Dr. Bright, for being here today.
Okay, I'm going to hop ahead, by the way, to...
Just want to tell you that my family...
Hold on.
Republicans like Hogan, like Phil Scott from Vermont.
Peter Welch is
who have
great.
done a tremendous job. But no matter how good they do their job, can they protect their people without the aggressive intervention of the federal government playing its role?
I think the federal government plays a critical role in coordinating and aligning and making an equitable distribution of those critical supplies.
That's
I believe
crazy
That's
talk.
what we'd practiced and exercised in the past, that there would be a
Obviously.
critical role for the federal lead in coordination at the state, local, and tribal and territorial levels.
Thank you, Dr. Bright. I yield back.
Gentleman yields back. Pleasure to recognize the gentleman from Georgia, Mr. Carter. Do you wish to question, or do you want to pass?
No, he's passing.
Reserve. Okay.
Yeah.
The gentleman from
I don't know if the
California,
Republicans
Mr.
are doing
Ruiz.
this because they just want to, like, bully him in one big pile at the end. House Sparks, the female speaks about how, because this is a great part. Okay.
Is recognized for 5 minutes of questions. Dr. Ruiz.
Thank you. Thank you, Dr. Bright. Thank you for your testimony here, and thank you for your service to our
Raul Ruiz is an emergency medical, he's a emergency room doctor.
country. My heart aches for the family and friends of the over 80,000 in America who have died of COVID-19 in such a short period of time. In fact, my heart aches for those closer to me. The Riverside County has reported 228 deaths. As a doctor, I appreciate your written testimony that states that science, not politics or cronyism, must lead the way to combat this deadly virus. There's been a lot of hype about cures for COVID that have been shown to be ineffective and even dangerous. We are now seeing the very real dangers and consequences of not making decisions based on science. Hydroxychloroquine, which Fox News commentators and then the White House repeatedly touted and actually encouraged people to use, is Exhibit A on this list. But there is one drug that appears to provide some therapeutic benefit, remdesivir. 2 weeks ago, Dr. Fauci announced that remdesivir showed a clear-cut, significant positive effect in diminishing the time to recovery. My understanding is that in January and early February, you launched a comprehensive review to assess which existing drugs might prove a therapeutic benefit, and you quickly identified remdesivir as the most likely drug to be effective against COVID-19.
Those of you that have been watching my show for a while, I brought this up almost at the exact same time. Just, if you'll recall. Anybody want to roll back to when we were talking about remdesivir and remdesivir?
Can you describe how you came to that conclusion, who you told within HHS, and what the response was?
Yes, so that conclusion came about by a technical review from a number of scientists within HHS, so the CDC, FDA, NIH, and BARDA, but it was also aligned with a scientific assessment from WHO and a number of global experts who rapidly looked at every potential drug and ranked remdesivir as the drug that had the most potential for benefit.
Who did you tell, and what was the response?
We shared that information with Dr. Kadlik. We shared that information within HHS leadership as well. We had discussions about the actions that could be considered for acquiring the limited supply of remdesivir.
So what was the...
Notice that, the limited supply. So there's crap tons of hydroxychloroquine in the world. Its commonality is partly why it exists, because they treat people who have malaria, and malaria is a malignant disease all over Africa. So there's a lot of production, especially in India and Pakistan, of low-grade, poorly formulated hydroxychloroquine tablets available in the world. That's it. And the US FDA has a higher standard for what we believe you should, the quality of the hydroxychloroquine you should get. Japan has a similar standard, South Korea, I think, as well, and most of Europe. That said, it's still way easier to get. Remdesivir isn't. It takes longer to produce. It's an intravenous drug. There's a lot of elements that go into creating it and materials needed to do so. So you've got to get a jump on it.
What was the response?
And we had discussions about how to ramp up production of more remdesivir in case the randomized controlled clinical study that the NIH was conducting came through with positive.
And so you had a discussion, and what was the response? Did anything happen?
No decision was made at that time.
My understanding is that Peter Navarro,
if you choose not to decide, you still have made a choice.
White House trade advisor, reached out to you on February 7th to seek your counsel. You told him about your top 3 concerns: the shortage of N95 masks, the need for a quote-unquote Manhattan Project to develop vaccines, and securing adequate supplies of remdesivir. Can you tell us if Mr. Navarro agreed with you and what steps you and he took?
Mr. Navarro did agree with me on the remdesivir, the N95 mask, and the Vaccine Manhattan Project, and he drafted a memo on February 9th to the White House Chief of Staff and Mick Mulvaney to share with the White House Task Force.
The directive for HHS to act on remdesivir occurred on February 10th. What happened next? And did the department promptly procure the needed supplies of remdesivir?
We did not proceed with procuring any supplies of remdesivir.
Okay.
That's interesting. Boy, but we bought maybe you weren't pronouncing it right. Maybe that was it. Remdesivir.
Once it was
reluctantly aroused. It was hard to get it aroused, and it is hard to get it aroused, but we got it aroused.
Okay. You were removed from your position.
Thank you, Templeton Zerat. Merci beaucoup, and thank you, Carl. Yay! Scourge! By the way, like I said, big ups for Dr. They've got him as Mr. or Representative, but Dr. Raul Ruiz, he's in the Riverside area near Los Angeles, and
position on April 22nd. By the time you were removed, had the department settled on a plan and procured the remdesivir?
No, sir, they were still
No, they haven't.
discussing slide presentations about potential donations of remdesivir at that time.
So what you are describing is a gang that couldn't shoot straight, and yet we are in the middle of a pandemic. There is one drug the experts say could make a difference, and in fact has been shown to make a difference, yet the department can't seem to figure out how to acquire it. A week ago, the Washington Post published an article on the rollout of remdesivir, describing it as, quote, confusing, unfair, and marred with incomplete medical information, unquote. Doctors described how they can't obtain the drug and don't understand the process for accessing it. Dr. Benjamin Linas from the Boston Medical Center said, quote, there's no transparency. The process is just a staggering injustice. Dr. Bright, you were warning about this over 3 months ago. If the department had listened to you and the other experts at
He's an emergency room doctor.
your agency, could this fiasco have been avoided?
We would have had a plan, sir. We should have had a plan for that drug and any other drug in limited supply.
So it didn't have to be.
Any other drug in limited supply. You know what's not in limited supply? Hydroxychloroquine. Yeah, well, I guess technically the high-quality version of it that we use for people who have lupus and are dealing with malaria, specifically under a medical doctor's supervision, those folks get the better quality of it, so it's probably in short supply. But the 29 million doses the president was buying from Pakistan to pour down the gullet of comatose veterans, not so much.
Right.
Here's what I don't understand. You were right about the dangers of hydroxychloroquine. You were right about the benefits of remdesivir. You were right about N95 masks and other critical issues. Yet you got fired from your job while officials who botched the response and ignored your warnings stay in theirs. Not only is this unfair to you, it's completely dangerous to the American people. I yield back my time.
We like notice the difference between him and a bunch of other people. Anyways, he definitely made a statement at the end, but there were 15 questions in there with direct answers to get stuff on the record.
The gentleman yield.
That established dates, that established contacts, that established who spoke to who and who knew what when. That's what you do.
It's back. I'd like to clarify something just very quickly. Relative to your leave, Dr. Bright, are you on accrued vacation time now?
I'm sorry.
Are you on accrued vacation time now?
I'm on approved vacation leave today, yes. I talked to that.
And would you be willing to share the exhibits once you personally, once you remove personally identifiable information?
Congressman, I'm having trouble understanding you through the mask.
Oh, I'm sorry.
Sorry.
I'm getting so comfortable wearing a mask, I forgot I had it on. Would you be willing to share the other exhibits once you remove personally identifiable information?
Yes.
Thank you. All right.
Chairwoman, we will make them available after the hearing today when we've had a chance to review it.
Thank you.
Oh, Madam Chair, will they be made available to the minority as well as the majority?
Absolutely.
No, absolutely not. No, you're going to have to, will they be made available? They're made available to the committee and you're on it, dummy.
Available to the entire committee.
Perfect.
Yeah, dummy. That's how government works.
Never shared anything with the majority that.
Why didn't you cut to him so he could go, finally, and pretend that he doesn't get his stuff? Thank you so much. Hold on, I want to... Thank you so much, James. I appreciate that. Man, oh brother, love your show. Thanks. That's Energy. Great book. Please read it by Paul Williams. Will do.
That hasn't been shared. This is a bipartisan issue.
It's a bipartisan committee. It's a committee. Everybody on the committee gets the same shit.
Thank you.
What are you talking about? Send your staff member to make a copy.
If there's anything in those exhibits that hasn't already been released to the public that might be degrading, will that be kept in confidence amongst committee members?
I'm sorry, I didn't hear you.
That might be degrading? What kind of dick pics are we expecting from this?
Not knowing what's in the emails, I'm wondering if there's any information in there that might be deemed to be degrading, would that be kept in confidence?
Degrading? To who?
Amongst the committee members, as opposed to being released to the public.
Oh, so if they shit talk the president and call him a dumbass, and the people and Peter Navarro agrees, and there's stuff in the emails where Navarro's like, "Yeah, I know he's a maniac, but we got to do something." You mean you want to black out that part? Look at the look on her face too, like, And her assistant goes, Do you need translation? I speak bullshit. If you need me to talk to him, I can do that for you.
We'll follow the rules.
And that is in compliance with Rule 11. Thank you.
Thank you, sir. Okay, I now have the pleasure of recognizing the only pharmacist in the United States Congress, Mr. Carter.
Thank you, Madam Chair. Thank you, Dr. Bright, for...
Thank you. I'm very excited to be here or whatever. I'm on a combination of drugs right now that are spectacular.
being here, and thank you for your service to our country. And before I begin, let me extend my condolences to those 80,000 plus who have lost their lives and to their families as a result of this pandemic, and a shout out to all of our healthcare professionals, as well as our other essential workers who have put their own health in danger in order to provide services.
Why does he have my grandmother's voice?
Services to our citizens.
Buddy Carter, Republican, Georgia.
Dr. Bright, it's my understanding that in 2017, BARDA funded a project with Applied Research Associates of
He's a pharmacist, ladies and gentlemen. You're a pharmacist. If you're gonna tee that up, only pharmacist in the entire Congress, and you're gonna have trouble saying that. Maybe that's why you can't. Is his license intact?
Albuquerque to develop respirators that could be sanitized and reused during public health emergencies such as what we're going through today. However, according to recent reports by the Washington Post, none of these next generation respirators are available for us today. Why is that? Do you have any idea?
I'm not aware of that. So you're talking about the ventilators, sir, that we developed? Or?
That's correct.
Then say ventilators, not respirators.
Talking about those that were developed, the respirators that were developed and could be sanitized and reused during public health emergencies.
Okay, so
it's my understanding that was contracted.
He's developed. That's not his job.
And that that project was scrapped.
Sir, I'm not familiar with that project. We sanitize the respirators.
You're not familiar with that project, and you didn't sign off on that project to your knowledge?
I'm not familiar with that project, re-sanitize respirators.
Okay, fair enough if you're not familiar with it. Let me ask you this. We've had a lot of discussion today about hydroxychloroquine, about chloroquine, and I'm a little bit confused here because it's my understanding that this is what BARDA, do you want to clarify something here? I see you. Okay. It's my understanding that
what a strange little man. What a strange little man you are. Are you in a barbershop quartet?
The role of BARDA, the mission of BARDA is to look at things like this. In fact, when we in Congress allocate money to go toward this, that you are supposed to be looking, that BARDA is supposed to be looking at things that could possibly have merit, such as hydroxychloroquine and chloroquine.
Yeah, they were setting up clinical trials. Did you not hear his testimony from before? Was I the only one listening? Did you guys hear that? Maybe you're confused because you got shit in your ears. He was mentioning this earlier. He was saying, yeah, we were trying to get doses of it. We managed to get those. We got them donated for controlled clinical trials. The problem we had was directives from the White House to force the production and use of hydroxychloroquine when we knew the dangers of it before we knew it had any efficacy. Hence, dead vets.
Chloroquine. And early on, it appeared that you embraced that. And early on, it seemed that you were in favor of looking at that. And I'm just wondering...
Right, can't stop lying? Am I not... What are we going with? I'm going with Alto.
Because of this pandemic, because we didn't have any vaccine or any kind of agreed upon treatment, we should be testing, and that's what we are appropriating that money for. Would you agree with that? That that's what we are trying to do, is to look at what could possibly work and work with public.
Yeah, that's what he said. That's what he's been doing. The problem he had was buying 29 million doses for widespread use just to see if it works, when you know it has ramifications, like it causes heart attacks. Like
Companies to try to.
Aren't you a pharmacist? What's the daily rate at your pharmacy like?
To encourage them to come up with those kind of.
I know you're here to treat your asthma, but have you tried speed? Some people talk very nice. They are very excited about it. It's anecdotal. What else do I got? I got some syphilis meds that Trump left behind. He hasn't used them at all. Wait, you want nothing cherry flavored?
Solutions?
Absolutely. We should look at all options and make sure we evaluate the potential risk and safety and benefit of those in the context of a randomized controlled clinical study.
Yeah, that's not what I'm talking about.
In the context of emergency, we should move swiftly and get that clinical data as urgently and quickly as possible, but we should not proceed recklessly without that clinical data on its potential adverse events in an emergency.
So you're referring, when you say we should not proceed adversely, you're referring to hydroxychloroquine and the chloroquine?
We were promoting the standing up of randomized controlled clinical
Thank
studies.
you, Paul, by the way, Belage, for those. Appreciate that, Rebecca.
The NIH with hydroxychloroquine. I worked with a company to even ask if they would donate drug to the NIH to be used in the context of a randomized controlled clinical study.
Right.
Yes, so that is what BARDA would do.
And in fact, I think you worked with the FDA to get an emergency use for hydroxychloroquine, is that correct? And it was actually approved by the FDA.
That was.
Yeah. Gee, who pressured the FDA to approve that?
In the context of the directive we
And that's not what he does.
received from the Secretary's office to stand up an expanded access protocol. Our clinicians.
So are you saying you were instructed to do that and you did it against your will, or?
So we were instructed to put in place an expanded access protocol. So in the context that Americans would be able to access this drug and not be under the close supervision of a physician. The scientists at FDA, NIH, CDC, and BARDA worked together to change that directive to the context of emergency use authorization with guardrails in there so patients would be under the close supervision of a physician.
Understood. Let me ask you this. Initially, you appeared to be encouraged by what could possibly be a result of the effect of hydroxychloroquine. When did that change? When did you?
When the president wanted to buy 29 million doses of it and dump it all over New York City.
You sour, if you will, on
That's what he became. He's a sour man.
the use of hydroxychloroquine.
I believe that we've seen many drugs that could have benefit, and some of these are really interesting things we'd never heard of, some we have.
I understand that, but my question was, when did you sour on it?
When it was determined that this drug should be made available to Americans outside the context of a close physician supervision. So I supported conducting a randomized controlled clinical study for hydroxychloroquine at the NIH. When I learned that there is a directive to make it more broadly available, not under close supervision of a physician, I was.
When was that? When did that directive go out?
That was March 23rd.
March 20, and that's the time that you decided, no, this is not what we should do, and we should not be looking at hydroxychloroquine at all.
No, that's not what he, look at that. Listen to the shaping of that question. Could you be dumber? Especially as a pharmacist. Did he say we shouldn't be looking at hydroxychloroquine at all? No. His problem was making it widely used before its efficacy was tested, which is very dangerous, and allowing it to be used without close clinical supervision.
I didn't think that was the proper, safe way to evaluate that drug in the context of this outbreak. I believe that should be only done under close supervision of a physician. When we put the EUA in place that locked this drug down to only be used in patients under close supervision of a physician, We were satisfied we had those guardrails in place. When an email string followed a week later saying, ignore the EUA, push this drug into the retail pharmacies in New York and New Jersey, that's when I became more concerned.
Uh-huh. Thank you, Joe.
Who put that directive out?
Who put that directive out? What we have here is a failure to communicate.
Time has expired.
Who put that directive out?
Gentleman's
Hey,
time
Cosmic
has
Rose.
expired. You can answer, Dr. Bright.
Which directive, sir?
That it should be put out to the public without physicians approving it?
That directive was an email string that had a number of individuals on it, and I believe it first came from Dr. Giroir, the Assistant Secretary of Health. It indicated the White House was asking for that drug to be more broadly available.
So was
That indicated that the White House was asking for that drug to be made more widely available.
Is it because the president was encouraged by the use of this drug that
Good point, Billy. It is a Republican pharmacist, so.
you became discouraged by it?
It had nothing to do with politics, sir. I wanted to make sure that Americans were aware of the risk of this drug. It was only available under very safe.
But it is a drug that is indicated and has been used safely in the past.
By almost 1.5 minutes. You can finish your answer, Dr. Bright, and then we're going to move to the next member.
You know, aspirin can cause stomach bleeding, right? Aspirin's been used very safely in the past, so why not just tear the label off and tell people it's good for pain and let them chew on them, and you know, as many as they want a day? Why have any recommended dosages at all?
The drug had been used safely for malaria for a number of years. We didn't have a database.
But it's being
Thank you, Cosmic Rose. I will be on later with Trump is going to be delivering remarks. And he may have already started, honestly. At the distribution center. Please don't be rolling. Pause. No. So I'll do that one later. But this is, this has precedent. So there you go.
being used in the same dosage as it was used for malaria.
Please. And I know that I'm overly generous with both sides of the aisle, but I think that we need to move on. I mean, 2 minutes of extra time is 2 minutes of extra time, and I'm not going to ask that it be shared over here. The gentleman's time has expired. It's a pleasure to recognize the gentlewoman from Michigan, Ms. Dingell, for her 5 minutes of questions.
Thank you, Madam Chair. Thanks you to both you and Ranking Member Dr. Burgess and Dr. Bright for your being here today. You're doing a great service. I think we're here today because COVID is real. I share the sentiments of many of my Republican colleagues that have expressed the thanks to the frontline workers asking questions. I want to look at the last few months. COVID's really real in my state. Michigan's the 10th largest state in the country, and we were third in the number of cases for weeks. We were third and remained there until this week in the number of deaths. We managed to move to fourth place 2 days ago, which is not a number anybody wants to be. My family alone, a cousin woke up with 104 temperature and was dead that afternoon. There are people still dying every single day. I have lost someone I've known. Sunday, Monday, a brother-like friend to me, Tuesday and Wednesday. And then we hear the scientific experts, yourself, but Dr. Fauci, other scientists around the country saying to us, if we don't listen to them, we could begin to see, well, we're going to see a return. You call it a dark winter. I call it, I don't want to see any more spikes. I don't want to see anybody else die. I am losing too many friends that I know, and people across the country are. So I want to focus.
Are there little black baggies on the microphones that they like wash afterwards? Is that their idea of keeping them clean?
On an area that's not your area of expertise, but it's mine, car safety. We expect our cars to be safe, and we expect car manufacturers to be responsible in making sure defective cars aren't sold.
I love analogies that I made 2 days ago showing up on the House floor.
And if they fail in that responsibility, we hold them accountable. If an engineer in a car company realized a model had serious defects and warned her management about that, we would all think she had done her job responsibly. And if management ignored her and our committee found out, I will bet you right now we would be having hearings. And if Americans died driving those cars, the companies would be sued and they would be charged with criminal negligence. In fact, several years ago, before my time, this committee investigated airbag defects and vehicle safety. At the time,
By the way, we're definitely not going to be suing a drug manufacturer in Pakistan. So I hope she's getting around to the idea that Donald Trump is the negligent party in this.
this subcommittee's ranking member, Dr. Burgess, said, there is no room for going slow when it comes to safety. And certainly, deception cannot and will not be tolerated. Dr. Burgess was right then, and our car makers have to be accountable. But what I'm concerned about is that we aren't applying these same standards to coronavirus. And I want to learn from what's happened so we keep that dark winter you're talking about from happening. It seems to me, Dr. Bright, you acted the same way the auto engineer I mentioned should act. You identified serious problems and then suggested fixes when it came to diagnostics, N95 masks, other equipment, and medicines. Is that right?
That's true. And Congressman, we still have those challenges.
Do you believe if your suggestions were implemented, lives would have been saved and the severity of the pandemic might have been lessened?
Might.
I believe lives would have been saved if we had proper medical protective equipment for our healthcare workers. Yes.
So people died because you weren't listened to?
People died because they didn't have appropriate protective equipment to save their lives and protect them from getting infected.
The problems aren't limited to just ignoring your advice. The American people are confused, given mixed signals, and quite frankly, some days just simply deceived. Let me give you an example. There was a visit to the CDC on March 6th, and at that visit, the administration said, anybody who wants a test will get a test. Was that true then?
There still are not enough tests.
So even this week, as we're being told, anybody who wants a test can have a test. Is that true in the United States of America?
No.
In fact,
thanks. Hearing dismissed. We'll just call it, and we'll see you guys tomorrow. And thanks for stopping by. Appreciate it.
all the experts say we're doing is only a small fraction of the tests we need to do to reopen safely. I'm running out of time, so let me ask you about vaccines. We keep being told by the White House that we've heard very soon, quick numbers, a matter of months for that vaccine to be developed. This is your area of expertise. You are a top immunologist in the world. Was there any scientific basis to suggest in March that we'll have a vaccine in the next few months?
There's a lot of optimism. There's a lot of hope, but that doesn't make a vaccine. There's a lot of work that needs to be done to make a vaccine.
Will we be able to vaccinate people in the next few months?
It's very unlikely.
Thank you, Doctor.
Gentlewoman yields back. It's my understanding the minority is passing, reserving.
Yeah, passing, reserving. I'll reserve my time and then never visit it again.
How have you seen this impact the devastation of the disease?
Okay, so most what we're going to be hearing is it's all Democrats right now. No, well, here we go. We might get one. Let me see. Nope. I made a terrible assumption, and it was very racist. I assumed that the first white guy I got to was a Republican. He is not. But here you go. Michael Burgess from Texas. Let's see what Michael Burgess feels about hydroxychloroquine.
Thank you.
Thank you.
I'll ask the, yes?
Just was going to ask if I could be recognized for concluding remarks.
Yeah, I'd be glad to. Dr. Burgess,
Thank
you're
you.
recognized.
And as I outlined at the beginning of this hearing, there are a number of things that we do need to look into, and I hope that we will. This crisis has been going on for several months. We had an hour tacked on to a budget hearing at the end of February, and then this is the first glancing blow we've had against this crisis. So I welcome the hearing today. I think it's important. I appreciate Dr. Bright being
Tell that to the Republicans on the committee who think it's a waste of time.
here. I appreciate him bringing his guest.
His guests? You mean his attorney?
I do think we need to look into the issue of testing. I simply do not understand how the CDC got so far behind the curve at the beginning, and I would like to know that. But I also feel like there has been, in previous administration, there was an effort.
Cheers, Pamela. We're almost done.
Really?
I'm gonna take a break right after he's done, and then I'll see you guys later on this afternoon.
Regulate what are known as laboratory-developed tests and move those away from CLIA-regulated products to FDA-regulated products. And that really did put us behind. The innovators have now stepped up. I'm thankful that they have, but we shouldn't have excluded them in the first place. And I think that was, when we look back on this, that is going to be one of the failings at the federal level. And that's not a recent failing. That goes back to guidances and rules that were issued back in 2012, 2014. As far as testing is concerned and the ancillary supplies, there are tests that might just involve taking a salivary sample. That'd be great. Spit into a cup, not have to deal with one of those obnoxious swabs going halfway down your throat. I suspect those cups are probably in greater supply and more readily available. And then, Dr. Bright, you'll remember I had an interaction with you.
How do you get the sample out of the cup? You use a swab. All you're doing is adding a step. Unless they spit enough you can pour it on something. How much spit are people producing? How much PPE are you going to need when people are hawking loogies to get a test?
You, in March, I've had people pounding on the door with all kinds of ideas. I have people that want to make personal protective equipment. They turn their furniture shop into a PPE manufacturing shop. They had difficulty getting through the bureaucratic cul-de-sacs at the various federal agencies.
We had a CIA-linked paramilitary organization with an office in D.C. with no employees who got $55 million to make PPE when they hadn't made it. You know, it's just, there's too much red tape.
I've got a man that's got a breathalyzer test for COVID-19. I don't know whether it works. If it does, it's pretty intriguing. A mobile unit about the size of a bread box that you could take from place to place. You simply blow into a tube and
catch it from the last person who used it.
We'd have to have more straws. We've outlawed them recently, but that could be dealt with. There are some innovative things out on the horizon.
A plastic straws jab.
The vaccine worries me too, because I recognize there's some illnesses for which we have never found a vaccine. H1N1, and I realize that's different because that was a flu vaccine, but that did happen in about 8 months, if I recall correctly. The outbreak happened at spring break. We didn't know.
And President Obama got a shot for H1N1 during Christmas break.
If we're going to be able to open the schools in September, but the vaccine was generally available mid-September to early October, depending on what part of the country you were in. So that success story gives me some hope that perhaps there is going to be light at the end of this tunnel in the form of a vaccine. But I do welcome that we had the hearing today. I look forward to a number of additional hearings. The ranking member of the full committee was quite correct to invoke Rule 11. We will keep that as an option going forward. And I thank our witnesses for being here today, and I'll yield back.
The gentleman yields back. Thank you again, Dr. Bright. And the first panel has completed testimony.
Yeah, that was his closing remarks, Templeton.
And I just asked the staff to prepare the table for our next witness, and then we will begin in just a few minutes.
Great. I'm not going to be covering the next line of questioning. That, and by the way, that is, let's see, who is it? It's Mike Bowen, Prestige American Executive Vice President.
With us. Unfortunately, most returned to buying cheaper foreign-made masks when they became available.
Okay, so this is just about masks and PPE. All right, I'm going to let you guys go. I'll come back later. I just wanted to pick up some of what Dr. Bright was saying and go through those. So have yourself a nice lunch, and if you feel like joining me later on today, it is Thursday, so because I have family FaceTime, like our group gathering at 3 my time today, I will be on basically right after that. So I'll pop back on. I'll set up a little social media signal flare and let you guys know. It'll either be 3:30 or 4 o'clock. Probably 4 o'clock is the easiest if that works for everybody. And we'll try to build on that. So yeah, more than likely it'll be 4. If it's a little earlier, I'll let you know, or I'll get kind of rolling into it. We'll have a rolling start. Yeah, let's just plan for 4 o'clock, and that'll make it easier on everybody. And I will see you guys later on. I'm curious what clips they end up pulling from this, besides we're in deep shit, which is apparently going to be the key takeaway from this entire thing. So, all right, I'm going to sign off. I will see you guys later. If you get a chance, join the Discord. Links abound. And if you want to support the show, patreon.com/HalSparks. It's a really easy way to do it. There's also paypal.me/HalSparks if you want to do it that way. And super chats are always welcome. That's how we create the show now. So I appreciate you guys very much. I was looking into the old camera and then this. Yeah, because now it all works or whatever. So I appreciate you guys for helping us get geared up. And we'll see you later on today. Yeah. All right. Cheers, everybody. Bye. Wait, I should have play out music, because that's the way we do it around here. You know what I mean? Super important.
That was really cool, by the way.
Just follow the money.
I gotta barbecue your assy molasses!
That's great psychology. Why don't you just say something bad about my mother?
You're not hearing what I'm saying.
Oh, that's okay, Doc, because you're not saying what I'm hearing.
Moon River. We're honored to have with us today our amazing Vice President, Mike Pence, and his wonderful wife, Karen.
The sportos, the motorheads, geeks, sluts, bloods, wastoids, dweebies, dickheads, they all adore him. They think he's a righteous dude.